Pandemic is a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death.
Life pretty much froze after this day.
Coronavirus.
The coronavirus.
Coronavirus.
I've developed mild symptoms of the coronavirus.
COVID-19 can be characterized as a pandemic.
The new coronavirus is thought to have originated in bats, and the initial outbreak has been linked to a live animal market in China. But there are other conspiracy theories about where it may have come from. So, what should we believe?
Hey everyone, I am Region Oswe, a first-year student of Western Institute of Technology, taking up Bachelor of Science in Electrical Engineering. I am sharing you the advocacy regarding in COVID-19 pandemic. This pandemic is transforming the world around us, shifting priorities, repurposing resources, accelerating policy development, and more. In this new environment, tried and tested advocacy tactics like face-to-face interactions, ad hoc hallway conversions, and informalities are no longer viable options. Since the onset of the pandemic, policies have been developed and implemented with unprecedented speed of 10 taxing already overstretched governments when we identify gaps in policy or service. Provision instead of first loudly calling on the government to take action. We have seen success rolling up our sleeves and offering to take specific action on policy development, or dissemination ourselves with partners or establish technical working group. When our offers of help are not taken up expeditiously or we lack the resources to support, we can turn to the media for reinforcement. Our work toward creating equitable health systems for all does not cease because of a pandemic. While we respond to the urgency, all of the moment, we must find effective ways of balancing efforts to focus on both short-term needs for COVID-19 response and longer-term health system improvements. As governments rapidly build health system architectures to respond to the needs of today, there is a special opportunity to reimagine primary health care in alignment with political commitments of placing. Also consider the ongoing need for medical oxygen. For the treatment of the childhood pneumonia, we have also found success in highlighting the indirect impacts of COVID-19 and the disruption of essential health services on vulnerable populations, issues that must remain on the policy agenda during and after the pandemic. During the current COVID-19 pandemic, it is fundamental that we continue our activism and raise awareness for what is meaningful to us. At times, this has required us to be more creative and think of new and innovative ways to bring our members together. One of the most significant lessons that this year has taught is that we can still have fun together and learn from one another even at a distance. Let this be a reminder that if something is important to you, you can still raise your voice and awareness for it.